Hi there, this is Anna, and I'm showing you here the palatal surfaces, and you see the wear and her occlusion when she closes. And she's got a very tight mouth, and she's got a huge tongue. She's you see, it's really difficult for me to see what's going on here. So I'm going to run this video a little fast, but let's see if we can keep up the track. I've tested the joints and things like that when I did the exam. Here I'm just testing how much space do I want, and I want to separate her posterior teeth in the first treatment today, and that's doing direct composites on canine to canine in the upper jaw, and that's gonna separate her posterior teeth and act as an anterior deprogrammer. I take the color check here, and I clean the teeth, and then I of course I clean them even more, and then I will isolate. And for this case, I will do rubber dam. I sometimes use just an obfuscate or just cotton rolls. It depends on the case. Here it's the rubber dam because her tongue is all over the place, and I just prepped a little. I roughened the surface, and now I'm etching it. And this is freehand bonding, so I'm going to isolate to the neighboring teeth, and I'm going to build the two incisors first, and I do the bonding. And I'm old-fashioned here. I do the 3-step etch, prime, and bond. And then I start to build up the composite. And now we're going to jump until I'm finished all 6 anteriors, and I'm going to take off the rubber dam in a minute. Follow the instructions on your bonding system. It's very important, always. Here it looks awful now. It's not polished, it's nothing, it's just built up, and you know, I lose track of everything when she's in rubber dam and I don't have a stent. I take everything off, and now it's time to contour and polish and things like that. And when you do things like this in freehand build-ups and you don't have the palatal surface fixed, it's pretty difficult to make the right size of enamel, composite enamel and dentin. So sometimes, and you'll see in this case, I will redo one of the incisors, not this day, but another day. This is an important step here, the guidance, and you know, it's a whole course in itself, and I'm running it fast here, but I'm using her as the articulator actually, and this is what you need to get your head around if you want to do things like this, and it's great fun when you get your head around it. So I think we just check her, and now she's open in the back, and things will just work fine. We'll see her in a week to check her symptoms, to check the bite and the aesthetics, and I think that's it.